What does clean air mean for a state like Arizona? I have the honor of introducing Chair Jennifer Allen.
Thank you, PETA. So good morning, and it is such an honor to be here with my colleagues. My name is Jennifer Allen, and I am the chair of the Pima County Board of Supervisors and representing District 3. I really want to thank Moms Clean Air Force for bringing us together to talk about World Asthma Day for an issue that is not abstract, it's not distant, and it is absolutely not optional. We often tell people, right, that we should stop and take a breath. But here in southern Arizona, for far too many families, breathing isn't calming. On the contrary, it's risky. Air pollution is not something happening somewhere else. It is here. It's impacting lives every single day. Ozone and fine particulate matter, known triggers for asthma attacks, are driven by heavy truck traffic, combined with our extreme heat, with the sunlight. Add to that windblown dust from construction, from proposed mining projects down the road from us, and unpaved roads, and wildfire smoke that increasingly settles into Pima County neighborhoods. This is a public health crisis. In Pima County, 250,000 children are exposed to unhealthy air. More than 16,500 Tucson children grow up using a nebulizer. Nearly 100,000 adults in our community live with asthma, where poor air quality means missed work, missed school, emergency room visits, and far worse. And let's be clear, this burden is not shared equally among our community. Indigenous, Latino, Black, low-wealth communities face higher exposure to pollution, higher asthma rates, often because they live closer to traffic, dust, and industrial sources. Environmental justice isn't accidental, it is the result of clear and specific policy choices. Nationally, nearly half of all Americans live in areas with unhealthy air. More than 7 million children live in counties that are failing them on air quality. The science is clear and the human cost is undeniable. Yet instead of strengthening protections, we are seeing federal clean air safeguards weakened, protections that save lives and keep kids out of emergency rooms. So today we say this clearly. Arizonans are not expendable. Pima County is not expendable. Our children are not expendable. We call on the EPA to follow the science and enforce strong clean air standards. We call on Congress to protect the Clean Air Act and put our community's health over the profits of polluters. Our children are already paying the price. We cannot ask them to wait any longer. Thank you. And now it is my honor to introduce Dr. Brian Drummond.
Hello, my name is Brian Drummond. I'm an emergency physician, Navy veteran, and chair of Arizona Health Professionals for Climate Action. Our health is being affected every day by air quality, especially here in Arizona. The combinations of allergens, particulate matter, and ground level ozone determines our air quality. Each of these is worsened through the consumption of fossil fuels, the main driver of climate change. Particulate matter is the size of our red blood cells. With each breath, that particulate matter is able to penetrate deep into our lungs where oxygen and carbon dioxide are exchanged. These toxins cause inflammation, irritation, which leads to difficulty breathing with increased mucus production and spasm of your airways. When our air quality is worse, I see more patients in the emergency room. They're struggling to breathe, needing medications, and often in severe stress. I have to teach them to look at air quality before they go outside and even consider wearing a mask to prevent them from getting sick again. Certain populations, such as children, community of color, lower socioeconomic groups, and those with chronic respiratory conditions are at higher risk and disproportionately feel the effect of poor air quality. This leads to increased medical expenses, missed days of work, and school days. We cleaned the air in this country with legislation such as the Clean Air Act. And now we need the EPA to stop rolling back air quality standards that are harming Arizonans. The cleaner our air is, the healthier we are. We need the EPA to strengthen air quality standards, acknowledging the scientifically proven data that poor air quality is a threat to all of us, especially our lungs and our health. We all deserve to breathe clean air. Thank you, and I'd like to introduce our next speaker, Joanna Struthers, Senior Director of Advocacy at the American Lung Association.
Thank you, Doctor. Hi, everyone. My name is Joanna Struther, and I am with the American Lung Association. More than 4 in 10, so 44% of people living in the United States are impacted by unhealthy levels of air pollution. Nearly half of the nation's kids are growing up in polluted air. In Arizona, it's far worse. More than 8 in 10 Arizonans, 86%, live in counties impacted by air pollution. Pollution from transportation, industrial processes, power plants, and other sources continue to put health at risk. Climate change is making the job of cleaning our air more difficult, as record heat and catastrophic fires add to our pollution challenges. On April 22nd, the American Lung Association released our annual State of the Air report. Our report looks at 2 of the most dangerous and widespread air pollutants, ozone and particulate pollution. This report grades counties' air quality in terms of unhealthy levels of ozone pollution, year-round and short-term spikes in particle pollution. And this is over the latest quality assured air quality data from 2022 to 2024. State of the Air found that Tucson ranked 41st worst in the nation for ozone pollution. Tucson saw more days with unhealthy ozone levels. This is up from their ranking of 62nd in last year's report. The report also found that Tucson ranked 53rd worst in the nation for short-term particle pollution, which was far worse than its ranking of 119 last year. Tucson also receives a failing grade for year-round particle pollution, ranking 41st in the nation, moving from its 48th spot last year. Ozone acts like a sunburn to the lungs, while particle pollution, especially PM 2.5, which is what we look at in this report, is an extremely fine particle that lodges deep down into the lungs. Both ozone and particle pollution can cause premature death and other serious health effects, such as asthma attacks, heart attacks and strokes, preterm births, and impaired cognitive functioning later in life. Particle pollution can also cause lung cancer. Infants, children, and teens as a group are more susceptible to health impacts of air pollution. Their lungs are still developing, they breathe more air for their body size than adults, and they frequently are exposed to outdoor air. Exposure to air pollution in childhood can cause long-term harm, including impeding lung growth, contributing to new asthma cases, and increased lifelong risk of respiratory disease. Emissions from cars and trucks and extreme heat are driving up ozone pollution, while prolonged drought conditions and catastrophic wildfires are contributing to particle pollution. EPA is making significant rollbacks to critical and life-saving clean air rules. For decades, EPA's implementation of the Clean Air Act has advanced this mission through strong commitment to health outcomes, robust science, and adherence to the law's role as a critical public health protection. This dedication to health has driven key pollution reduction benefits for the nation's children for generations, but that hard-fought progress is now at grave risk. We can clean up dirty pollution by transitioning away from fossil fuels and instead investing in clean energy and transportation choices. Our kids deserve to breathe clean air. We can grow our economy, improve the air we breathe, and protect the health of our families through zero-emission solutions. Thank you. And now I will introduce Fabiola Bedoya with the Moms Clean Air Force.
Hola, buenos días. Thank you so much for being here today. My name is Fabiola Bedoya. I'm a part-time field organizer with Moms Clean Air Force Arizona, and I am a single mom raising my son here in Tucson. Right now, what every parent wants is to have a healthy, safe environment for our children, especially those that are having issues with clean air. My son suffers from allergies, and I also suffer from severe allergies due to the air pollution here in our city. This is what families are living with currently. Children are especially vulnerable because their lungs are still developing and they spend more times outdoors, especially during the school year. Right now, children that live in areas that are more prone to having people of color, like the city of South Tucson, are more prone to this air pollution. Hispanic families are 3 times more likely to live in polluted areas. And they're more likely to suffer from severe asthma as well. In fact, right now, they're more likely to die from asthma rather than, let me go back. Hispanic children are 40% more likely to die from asthma than white children are. And these disparities are the result of policy and infrastructure decisions, not just by chance. Extreme heat and worsening air pollution are making asthma harder to manage in Arizona. Right now, families need stronger protections, not just rollbacks of clean air safeguards. Our children shouldn't bear the burden of pollution caused by polluters and weak policies. Right now, Arizona is uniquely positioned to lead with solar and clean energy. I mean, we have sunshine the majority of the year. Clean energy can mean cleaner air, healthier families, and actually lower utility rates. And right now, for many families, clean energy is not just a matter of health and survival, but it's not just a matter of, we're gonna roll that back. I give up on this, guys. Anywho, parents and caregivers are the ones who have the most impact to be able to make a difference, just to be able to voice what's happening, to storytell on what's going on in their communities and their families, and bring the most impact to these vulnerable communities that usually don't have a say in what's going on. Because if we come together, we can actually create a difference in our communities, have our people in leadership be held accountable, and overall just have it be so that no child, depending on a particular zip code, has to deal with the air pollution that we deal with on a daily basis. Thank you so much.
Well, thank you everybody for joining us, and thank you to every single one of our speakers. We will be providing quotes from every single one of them and posting this on YouTube for any further quotes and talking points that folks might need. Thank you so much. Thank you everybody. Let's get a group picture. I know we took a couple of them. Aaliyah, do you mind taking a picture of us, please?
All right, we want the sign?
Yeah, actually you're right. Right here. Man, I was cooking on that little piece of sun over there.
That's all it is. Come in the shade. Come in the shade.
All right, thank you everyone.